So let's join Dr. Tim McKnight this morning. First of all, good morning.
Good morning.
Good to see you doing well.
Thank you. You too.
Not wearing a tie today, but that's a different story.
Different story.
Okay. So we decided to talk a little bit about carpal tunnel, and this seems to have sprung on us in just the last few years. I'm sure it was there before.
Yeah.
Are we just more aware of it now?
I think when you get it, you become aware of it. But you're right; it's really common. I've seen a lot of it recently. I'm not sure why that is, but yeah, it's a very common condition of the hand, and what it leads to is numbness, tingling, and eventually weakness in 3.5 of the fingers on your hand. So it includes your thumb, index finger, middle finger, and the thumb side of your ring finger. That's what you get. They can get numb and tingly and start to hurt. And so it's compression of the nerve that goes right into the hand, right by the wrist, close to where those tendons are in your wrist when you look at them, kind of where you would check your pulse. Right, that nerve goes right in the very middle of your hand, and it supplies a nervous connection with those fingers.
Now, is that brought on? Could it be by use of the keyboard over and over and over and over?
Yeah, that's probably one of the most common causes for this. Now, actually, the most common cause for this is we believe it's genetic. So it tends to run in families, and about 10% of us will have some issue with carpal tunnel at some point in our life. But anytime you bend the wrist for long periods of time, you can squeeze or compress that nerve right where it goes into the hand. So that's why we think keyboarding can do that. Mechanics who are using a wrench or a screwdriver often, or painters who are bending the wrist back and forth as they paint, they're also, those are populations that can have the same problem.
It's an area of your body is kind of like a bottleneck. Everything gets squeezed into that one little space,
you're right. And there's a really narrow space for the nerves and the blood vessels to get into the hand. And right over the top of just underneath your skin and underneath those tendons, there's a little band, looks like a wristband that kind of goes cross-sectional or perpendicular to the axis of the arm. And when that band compresses on the nerve, it can cause that pain as well. So when we do surgery, we're releasing that band, and we just sort of cut that away, and it opens up, gives just enough room that it doesn't compress the nerve anymore.
We do not need that later? The band when it's cut or removed?
No, we can function without it. But most of the time, we try to go very conservative. A lot of times, you'll hear people say they wake up at night and their hands are numb and tingling, and they shake their hands. Well, that's probably because when they sleep, people tend to contort their bodies. They bend their arms kind of in the fetal position, and they bend their wrists as well, and that's the same. It'll compress that nerve. So when I hear that story, I'll tell them to get a wrist splint or a brace. And the idea is just keep your wrist in the anatomic position, nice and straight. With those braces, you can still wiggle your fingers and use your fingers and thumbs. But we're trying to keep the wrist from bending at night especially.
So where does this carpal tunnel come from? Carpal has to do with?
The hands.
Okay.
And so this is the tunnel that goes right into the hand area. So it doesn't really involve any bones. It's strictly the nerve. And it's called the median nerve. And the median nerve actually comes down close to your bicep tendon and goes right down the middle of your forearm. You have the ulnar nerve, which is the funny bone nerve that's on the inside of your elbow. And that, when you bang that, that will kind of rattle. You'll feel that. Everybody knows what that feels like. And that supplies the innervation to the pinky and the outside of your ring finger. So if those two fingers are involved, then we're thinking it's an ulnar neuropathy. And sometimes that happens also with continual trauma to the ulnar nerve, or perhaps even just bending the arm too much for long periods of time, and it kind of gets trapped in that little place where it slides through the elbow. So when I injured my elbow last 2 weeks ago, it was real close to the ulnar nerve, and I was kind of watching for that neuropathy to see if it would happen. But fortunately, it hasn't affected that nerve. But back to carpal tunnel, when we see this, we first try to identify what's causing it. So sometimes I will tell a keyboarder or someone who's a painter or a construction worker or a mechanic to wear the wrist splint during the day to immobilize that wrist. Sometimes that's enough, but sometimes it's beyond that. So We can use anti-inflammatories like ibuprofen or Aleve. We can use steroid tapers like prednisone or methylprednisolone. And when it doesn't respond to those therapies, the next step is to refer to a hand surgeon or an orthopedic surgeon, and they will often inject that area with a steroid, which will calm and quiet the inflammation down and take care of the problem. But if it doesn't respond, then surgery is the last resort.
So really, it's can be caused by overuse a lot. You said genetics are involved. Once you feel you're suffering this, there's really no way of prevention to draw it back other than total rest, I suppose.
Right. There's really no good prevention for it. And, this goes back to some of the conversations we've had with Dr. Jakubowski, where we're talking about good ergonomics, good posture, and just being careful with everything we do. So, that's about the best we can do. We also know that pregnant women often have problems with this too, because in pregnancy, they make a lot of progesterone. Progesterone helps them maintain the pregnancy. It's pro-pregnancy. Without progesterone, women can miscarry. So you make a lot of progesterone, especially in the second and third trimester, and that can cause water retention. And just enough water retention in the wrists can cause this problem. So we also see this with anybody that potentially is holding water for any reason, especially somebody maybe in congestive heart failure. They could potentially have that. People with rheumatoid arthritis sometimes develop carpal tunnel just for other reasons, but the inflammation can affect the nerve. So, there's several different conditions that kind of predispose you to this. But the most common cause is idiopathic. We don't know why. You come in and there's no good history of an overuse. So, again, we try the conservative things first, and then we go to either a steroid injection or a surgical release of that I think it's called a retinaculum, which is the fibrous bands that go over the top of the nerve, that we can just cut those and it opens the space up.
So I've had this surgery. I haven't, but let's say I've had it successful. Is there anything different that I need to do to try to prevent this from reoccurring?
Usually, from what I've seen, that's a pretty curative procedure. I don't see people come in after that and say they're still having problems unless potentially scar tissue has formed and it tightens up and puts pressure on the nerve again. So usually that takes care of the issue.
Now, if you do have it, from what I understand, pretty simple, fairly quick procedure, right?
Oh, yes, it is. It's a small incision, sort of at the wrist, kind of in the palm of the hand, and people respond well. It's not really a big deal. But you definitely want somebody that's a family practitioner should not be doing that. Anything with nerves and blood vessels and tendons, we stay away from those. We let the hand experts or an orthopedic surgeon who's done those, do that procedure. Some of us like to do as much as we can with a knife, but we're still cautious.
Well, yeah, I mean, so
and you're probably happy for that, right? You're glad to hear that.
Whew, I'm feeling a lot better now. So it sounds good. So is there anything else we should know about carpal tunnel?
Just don't put up with it like anything else. If you've got that numbness or tingling in those fingers, don't delay it. Just get in before it becomes more and more of a problem. I think too often people wait too long for these conditions. Just see your provider early and see if the early treatments, the conservative things, reverse it. Because if you wait too long, then you're going to look at it some type of surgical intervention. Mm-hmm. So that's probably my best advice for the early symptoms that people develop.
All right, very good. One quick question about Fit for Life. How's that going?
It's going great. We have, we have about 45 people in the class and another 10 or 15 online. Some people are even out of state, and this class is phenomenal. They're sharing recipes and showing us, what they're eating for breakfast, lunch, and dinner. They're logging their walking steps and sharing that with us. They're sharing inspirational quotes. So it's a really, really dynamic group, and they're doing great. So we're week 5 now, and we're kind of right in the meat of the program. Last week we talked about foods that make us sick and why, and this week we talk about foods that help us heal. And we talk about supplements. We talk about the value of good water. So now we're sort of in the healing phase of this, and people are hungry for the information. There are 3 30-minute lectures that are pre-recorded that they watch And it's just a lot of content. Usually, most people are watching that more than once just to get everything. And then tonight, I will add a few new pieces of information. We'll have some question and answer. So I tell you, it is fun to do this. People, when you see lives change, we had a gentleman in last week who was with us at the community hospice center where we held it a couple years ago. When he walked in the building, he couldn't walk all the way in and go to the class. He had to stop and sit down and rest. He was overweight, very out of breath. He was almost to the end of his rope, very, very helpless with his life. And we educated him, and he took on the challenge. Now, 2 years later, he's lost 130 pounds. He's back to work. He's got his life back, and he's just an inspiration to a bunch of people. And those are the kind of things that motivate us and make us really put our heart and soul into this so that other people have that experience.
I can tell it pumps you up just to see that happen.
It's wonderful. And we want people to be aware it's out there, and hopefully if anybody feels like they could benefit, we'd love to have them enroll in the class.
All right, very good. Thanks for that. Thanks for the update on carpal tunnel as well.
You're very welcome.
And keep healing.
Thank you.
That's Dr. Tim McKnight this morning on our Talk with the Doc.